Hey, hey, everybody! Happy Wine Wednesday to all of you. Today, oh, you know what? I gotta pull up my little cheat sheet here. And tonight we have the Godfather of seahorse breeding and keeping, Dan Underwood of Seahorse Source. And he's gonna talk about. Oh, better turn that down. I always do that one. Okay, he's going to talk about detecting, diagnosing, and treating the most common ailments, common problems with seahorses, captive bred seahorses, of course. And he'll take any questions you have. I'm hoping this turns into an every month or so thing where we can have him in here with his expert advice and opinions. So hopefully a bunch of you will join and have questions. I will provide a link and give instructions for the link as soon as we're done. As soon as I ask him my questions, and then you guys can join and ask whatever you want. But hello, welcome, and without further ado, I want to introduce Dan Underwood. Welcome, Dan.
Thank you.
Okay, and before we get started, what's in your glass tonight?
I got three.
You
I
have
got my
three.
yeah. I got my water. I got my coffee mug, and I've got my fresh squeezed homemade um, vegetable juice.
Now, see, just goes to show. I've had quite a few guests that say, but I don't drink wine. You don't have to drink the wine. I'll drink all the wine. I'm cool with it. So, Dan's sipping on the juice and the good, nice, good juice. And I actually am disappointed. Lucy could not be here tonight. She had to, she's off somewhere doing something. And the bottom line is, I actually found this new wine that's like specifically, it has an F for France, and I just know she'd be thrilled. It's not technically French wine, but I can't wait to tell her because it's excellent. I tried the different kinds, and the French was definitely the best. So, anyhow, I'll quit boring you with the rambling, but the wine is very good. French wine, yes. All right. So, Dan, let's go ahead and get started. A little bit just to give people an idea of where you're at. Tell me a little bit about how Seahorse started and how long you've been doing this, how long you've been working with seahorses.
Okay. Um, when I got started, I probably started a little different than most people. Most people get into this as a hobby, and way back in 2002, I was making trips to Florida for another company, and I was staying with my sister, who at that time was breeding seahorses or working with seahorses commercially. And she was explaining to me at that time how captive bred seahorses were going to be the next big thing. So the company I was working for sold in 2003. So my wife and I put the house up for sale. We got on the sailboat, headed to Florida, and met up with my sister with the intent of starting seahorse breeding. Things changed, and she had to step aside. So Abby and I spent from 2003 to 2005 studying, researching, experimenting, figuring things out. And then in 2005, we started Seahorse Source and have been at it ever since.
Yeah, I know the story, but I love it because it's a good one, and I love how you guys just picked up and did it. Very, very cool. And go ahead.
Neither one of us had any experience at all when we started. I didn't even know how to cycle a tank, and so we started from scratch in the very beginning.
And it just goes to show, if you work really hard at something, it turns out, because now you're truly the Godfather. People all know your name, so, and you help everyone. Which leads me to my next question. Your website, and you have groups on Facebook and MeWe, and they're a little bit different than typical, like, say, vendor websites or groups, because um, you actually provide information and go out of your way to help people. And you want people to succeed with their seahorses, not just sell them seahorses. So why did you take this approach, and what makes you continue to do that instead of just selling?
Well, the very first reason was I do like helping people in general, and I've never been one that's been stingy with information in each of the careers that I've worked. Um, but also, I also learned way back when in my early part of my sales career that if you help people get what they want, they in turn help get you what you want, which of course is the sale. So helping people was helpful for sales. It was also very helpful for word of mouth referrals, because if you help somebody and bail them out of a bad situation, they typically tell their friends. And then one of the other things that was very important to me at the time, there was a lot of seahorse companies coming and going, and everyone that would come in would be the next big thing. And it gave me a little bit of an edge on the competition. For the most part, in the aquaculture industry, everybody's extremely secretive, and particularly with seahorses, finding good information was difficult. So it really set us apart. And then lastly, seahorses are such a small niche of the market. The more that we helped people, the easier we made it for people. With seahorses having such a bad reputation of being so difficult to keep, by making it easier for people, it expanded the market. So,
Yeah. Sorry, go ahead.
in all of those things, every one of those things were beneficial to me. Now, I've caught a lot of flack for it, but I still think it was the right thing to do.
Oh, absolutely. And I'm sure it does catch you flack, but I just, I think there are a lot more people not only succeeding, but succeeding in different areas. I mean, you're helping other breeders and stuff. It's really, it's a different approach, but I think you're right. It does eventually in every way help you, and it helps the industry. And, so thank you. Um, Also, so basically, I wanted to ask you just some basic questions just to set the ground so that people who might not know you who tune in will obviously understand why, you know, I call you the Godfather of seahorses, seahorse keeping and breeding. You just really have the history there and the desire to learn and to help people. Okay, so but in addition to the groups and websites, you also speak at events. You were and are very active on any kind of seahorse forums. You provide these groups as we've talked about, and you help people. And I'm sorry, I'm trying to fake that I'm not reading here. I'm sure I'm doing a great job. All right. As more people turn to you for advice, you likely have to answer some of the same questions over and over again. And I even see some of these same questions over and over again. But you being the person that's literally done what was it called? The call-in center. People could call in and ask you something. Well, anyway,
Yeah, we called it the help desk.
help desk. That's it. So you've done help desks and all of these kind of situations. And do you have a basic? Can you? I know it's a difficult question, but what are the most common things that people seem to have problems with, or that seahorses have problems with?
Well, it's it's evolved over time. We don't get near as many calls today as we did in the beginning. Um, in the early days, we were dealing a lot with wild caught seahorses. Most people, when they bought seahorses in a store, were wild caught. There was very few captive bred. And of course, wild caught brought in problems such as, converting to frozen food, deworming, exposures to all kinds of different things, stressed out. Um, Over time, that has slowly switched over to where everything is now captive bred.
Mm-hmm.
Early on, with the way tanks were set up, we saw a lot of gas bubble disease, pouch emphysema, weak SNC, bacterial issues, protozoan infections, heater burns, all of these different types of things. But today, to give you an example, 10 years ago, it wouldn't be uncommon for me to have 5 different people working within a given week, actively working with 6 seahorses, where today my help calls are probably once every 2 or 3 weeks. So what we're doing with husbandry with seahorses has improved. We probably still have a ways to go, but it has improved drastically.
Great, and that's a question I'll ask you about later that I'm adding to my list here. But and I do get your point. It's a difficult question to ask, but it seems like things are getting better, which is excellent. So we'll talk about specifics in a second, but um, in terms of prevention, do you feel that some of the problems that people are still having can be prevented or avoided?
Yeah, I do. The key to it is first is buying quality captive bred seahorses. And if you set up the correct environment with the tank and provide the proper husbandry, you should not expect to have issues.
Gotcha. I mean, you already mentioned husbandry. You're saying those key words. Excellent. And I know it's kind of the same question, but do you have any other like recommendations that you give people to avoid any kind of issues, or do you have any specifics?
Specifics, no, it goes back to the previous answer.
Yeah.
And, I think looking for good sources for good advice and trying to get up to date information is difficult because, unlike textbooks, once it's posted on the web, it's there forever.
Oh, so true. That's been the biggest problem is overcoming incorrect information that we, maybe not wasn't incorrect then, but we've learned from it. So I totally agree. And I have noticed that when I see you go to work, and I say go to work because it's kind of a magical thing to watch you diagnose an issue with a seahorse, because you really just ask the questions, and it's like by the time you're through, it's so obvious. But when I start out listening, I think it's one thing and I'm wrong. So my question is, why is it so important for you when you're helping someone to get all the background information before telling them what to do or making an assumption or treatment plan?
Well, diagnosing is as much art as it is science. A lot of it comes from experience, but if you look at what happens with people, as a good example of how different it is, when somebody goes to the doctor, the first thing the doctor is going to want to know is what they call the chief complaint. Why are you there? And then they will ask you, the history of what happened. And sometimes during the history taking process, they'll do the physical exam either simultaneously or immediately afterwards. And after they get through talking with you and examining you, a good practitioner will come up with what's called a differential diagnosis. And then um, if they will order the lab tests, the x-rays, MRIs, or whatever to back up um, their belief of what the diagnosis is, and sometimes rule out other possibilities. With seahorses, it's an entirely different thing because not only do you not to get to speak to the patient, you really, your history is not coming from the patient, it's coming from a third, sometimes fourth party. And depending upon how well they observe things, how much information that they retain, your history can be very limited. You have no physical examination. So, and you can't do any lab tests to confirm anything. So the critical component of coming up with a recommendation or a diagnosis revolves around the history. So very rarely do people post enough information in a single thread or in a text or what have you. It usually requires me asking questions, and quite often, once I ask a question, then that in turn the answer may lead to more questions. So it takes some time to go through it, get all the information so that you have a complete picture to try to, come up with what's going on.
No, that makes sense, and that was kind of my next question. So, if you need to pass it, that's okay. But I was just going to ask, like, how do you base what are the typical questions you ask, or how do you come up with those questions? Is it just based on one question leads to another, or?
Well, every case is different. When I go back to my paramedic days, you pull up on the scene of a car accident, you handle it differently than if you pull up on the scene of a case where the guy's walking around in circles and appears to be out of his mind or something.
Sure.
You you get your initial set of information, and based upon that initial set of information, you go from there. Sometimes things are quite obvious, and sometimes it takes a lot of probing because the answer isn't immediately obvious.
Sure. For instance, one of the things that I often see people say is that their seahorse stopped eating. And I mean, just briefly, I know you can't cover it all, but just to give an idea, how many different things could have caused a seahorse to stop eating? I mean, quite a
Oh, that
few, right?
yeah, actually, there could be many, many different things, ranging from stress. It could be a bacterial or parasitic infection. It could be trauma. Then again, it may not be anything actually wrong with the seahorse. It could be a pregnant male, or in some cases, it's actually poor observation from the hobbyist who's not the seahorse is eating on the sly. So, there's many different possibilities for that.
Sure, we actually had a perfect example of that recently. If you watch the stream often, Edwin came in and his seahorse wasn't eating, and he ended up moving the seahorse to a more a better set up tank, and she started eating. She was likely eating the amphipods, so, and she was fine. So, and thank goodness we didn't advise him to treat her. So absolutely, that's why the questions are important for sure. And let's see. Okay. So, and I'm sorry some of these questions are similar, I realize now, but
It's all
why do
right.
you avoid giving overall treatment advice, and instead speak to the person who needs help? Okay, wait a minute. Why do you avoid giving overall advice and you seem to prefer speaking with the person who needs help instead of, just making an overall generic, oh, formalin for 10 minutes kind of thing?
So basically, the question, in other words, what instead of posting online a quick fix, you're asking why I want to speak to the people and dig a little deeper.
Yes, I'm sorry. Thank you.
Yep.
Yes.
Well, it's more expedient and it's more accurate to come up with what's going on and answering it. As I said before, many times I have a lot of questions that I want to drill down to, and if I try to ask those questions online, I got to wait for them to reply. I'm not an extremely fast typist, so even if I could type the whole thing out, it would just take much longer. Um, but in speaking with people, I get a much better mental picture of what's going on. And sometimes I also get information that people don't want to post online for various reasons. So I usually get a lot more information by speaking to people and get a better picture to come up with a better, more accurate diagnosis.
Sure, and that makes sense on both ends because I've been on the receiving end of just not knowing something and everybody kind of jumps you. So it makes sense, and it's just a better situation when it's one-on-one. I couldn't agree more. And let's see. Your website has a medicine cabinet. I will provide links to some of Dan's articles and his medicine cabinet and treatment options that he has provided on his website. Link those in the description. I've got them ready, so I'll actually do the links this time, guys. But he has a medicine cabinet that is much shorter than most of the articles you'll read online. I've seen some articles that are pages long telling people that they need all of these medicines for seahorses, and it's just, it's a lot and it's intimidating. And Dan's list is extremely short. And so, Dan, I was wondering if you could explain your basic recommendations of what people should have on hand when they get seahorses in case of issues and why it's so short. Go ahead.
It's a great question. In the beginning days, I, like everyone else, bought all the different things that needed to be on hand. And what I found is that many of the things I didn't use very often, and they would expire, which meant I'd have to replace them. And in many cases, not ever used them. So when I was looking at the list, I was looking at when I'm talking with somebody and they have a sick seahorse or a seahorse in trouble, what do they need to have on hand now? And so I developed a list of what they should have on hand for immediate, what I call emergent care. And the most of the other meds that are not on the list are what I consider meds that can be, they're not for urgent care, they're for further down the treatment line. So, you know, for example, if you look at the list, you'll see that I have a wide spectrum antibiotic in case it's a bacterial infection. I have an antiparasitic in case it's parasites. And sometimes you want to use a different antibiotic. Well, you can do that. You already have an antibiotic to get started with, and we can change it. And same thing with parasites. Formalin is typically the first go-to. And then if we need to go to praziquantel, metrodiazole, or some other type of antiparasitic, we can, and the customer has time to get those. What we don't want to happen is for them to have a sick seahorse, say a bacterial infection, and have to wait 2 or 3 days to chase down the medication to start treatment.
Sure.
So not only does it save the customer money, but it also increases the likelihood that they will buy what's needed. Quite often in the old days, when I used to talk to people, I'd ask them what they had in their medicine cabinet, and they would have all these different things in there, but none of the things that were needed for emergent care.
Right.
So I try to keep it as simple as possible with the hopes that people will get the simple things and have those on hand.
Sure. And just a quick note, Joanne and Ray, I do see your questions. I'm running through the questions that I had just to give a basic overview of treatment diagnosis and diagnosis and treatment. And then I will be providing all your questions. Dan can answer them all and anybody can join. But I'm almost through. So I do see them and we will answer them. Just give me like 5 more minutes, okay? Um, Okay, well, very quickly, just let's just run through it quickly. So for parasites, and I understand you would have to. Actually, I'm gonna ask you your recommendation based on just already diagnosing the problem. So obviously, we've made clear that you have to speak to the person to diagnose what the actual problem is. But just for a basic overview of once you know that it's this particular thing, what do you recommend? So for parasites, what's your typical recommendation for parasites?
Well, the first choice in most cases, uh, I'm assuming we're talking ectopic parasites, which is the most common thing we run into with seahorses.
Right.
And in that case, it's usually freshwater dip or formalin or both.
Mhm.
Then, we can go into other stuff afterwards. If it's internal, then we're looking at doing a whole different set of treatment.
Gotcha. And then, do you have a particular favorite or particular recommendation that you use once you have figured out that it's a bacterial issue, or
Yeah, with
just
bacterial, I found over the years through experimentation, my go-to antibiotic was Furon 2, which is a nitrofuran product, and it's a wide spectrum antibiotic. And it's very safe, it's very easy on the seahorses. I've had good success with it.
gotcha? And I do know. I just want to make the note that he's giving very. He doesn't like at all giving general. He's not recommending anything. He's saying just for overview because he has helped me personally many times when the problem called for metronidazole or however you pronounce it versus furon. So again, the main point here is it comes back to is you have to talk to an aquatic vet or a mentor that's extremely experienced to really diagnose what the problem is. That you have to do that before you can even start thinking about treatment. Okay, I'm trying to hurry through so you can get to the people. And I've seen you recommend quarantine for observation versus starting treatment. And what is the danger in treating the wrong thing, or what is the danger in using the wrong medication for a problem?
Well, the reason I sometimes recommend quarantine for observation is quite often I'm not convinced that the animal's actually sick.
Mm,
I've seen instances where there's a color patch. Somebody sees a little bit of a white spot on a seahorse, and they generally associate that with being the beginnings of a bacterial infection.
mhm.
And sometimes it is, but many times seahorses will have little coloration changes. And before we go treating the seahorse, I want to be convinced that it's actually sick and needs the medication. Over treating the animals, as a whole in the hobby, I think we over medicate fish. And I'm one of these people that I'm a little bit slower to medicate unless I know that there's an issue. Quite often, just placing them in a quarantine tank by itself with good clean water is enough for the immune system to kick in and for things to turn around. And it also gives us a good chance to observe the animal and verify what's going on.
Sure. And something you mentioned earlier, a lot of times, actually, I think you mentioned it on the phone. So I'm sorry if I'm stealing the stealing the answer, but he mentioned on the phone when we were talking earlier about, I was asking him how he can tell what something is when everybody else can't. And he was basically stating that there are little clues. For instance, if all the seahorses are sick all of a sudden, then it's usually a husbandry issue because they all don't. It's just really cool the things that he's learned with experience and how actually talking to him and actually observing, maybe putting it in fresh water and seeing if that makes a difference can really make a difference. Okay, I'm sorry. Back to the script. Okay, we're almost done, guys. All right. So how often are you able to help people with their seahorses? Like, do you have any failure or success rates or anything?
I've never really kept stats on this. I found that over the years, I have a very, very high success rate if people call me early on while they're having an issue.
Hmm.
The earlier they contact me with the problem, the higher the success rate. And I've had, success with some other things that were more advanced, but it becomes much more difficult, especially if the person isn't prepared. Um, but overall, I would say that, if somebody calls me very early on with something, I probably have about a 90% or better success rate and a good outcome. And when people do call me and ask me for help, after we get done with everything, I'll usually give them somewhat of a prognosis of what I would expect, whether it's, 50-50 outcome or a high likelihood of an outcome, good outcome, or if it's a poor outcome. And I do that because so many people become so emotionally attached to the animals that I'm basically trying to soften the blow of what's going to come.
Sure, and I think that's actually kind, not kind, because you've helped me with every single problem I've ever had, and I can say the success rate over here is 100%. But there have been a couple of times when we miraculously saved a seahorse, and you warned me ahead of time. Don't get too attached. So it does help in some ways. All right, guys. Last two things I just wanted to go through really quickly. The two most common things, asked Dan his treatment advice and diagnosis advice for the two most common things that he already mentioned earlier are no longer common things because we've corrected husbandry, and so it's not seen that often, but still people ask and people still have the issues. So the two things I wanted to ask about really quickly, final thing, Dan, is gas bubble disease and weak SNC. So for gas bubble disease, what's the difference between internal, external, and pouch emphysema?
Well, I separate pouch emphysema from gas bubble disease.
Okay.
So I mentally I think of them as two different categories. Gas bubble disease is two types. There's internal and also what we call, what some people call external, or I call subcutaneous emphysema, where there's little bubbles underneath the skin.
Mm-hmm.
And pouch emphysema is different than internal gas bubble disease or subcutaneous emphysema because pouch emphysema is simply gas trapped within the pouch of the male seahorse,
Okay.
and he can't expel it.
Gotcha. And so yeah, that was the next question in there is when you talk about the causes of each. Obviously, the pouch emphysema is caused by trapped air. What typically causes the internal and external? Do you know?
Well, it's a great question, and it's gas bubble disease is very poorly understood in
Gotcha.
seahorses. Um, I don't know of any studies that have conclusively found what the cause is. I've seen all kinds of different theories from supersaturation of gases to excess CO2 to bacterial issues, etc. But what we do know is that in the since we've changed the husbandry and since we've um, increased the flow rate, increased the filtration, lowered the temperatures in the tanks, and essentially reduced the amount of organics, excess organics within the system, the number of cases of gas bubble disease have dropped. So the underlying issue is excess organics. If you keep those away, then you keep the gas bubble disease away. And that works for both gas bubble disease and pouch emphysema.
Gotcha. Okay, final question on the gas bubble disease or pouch emphysema. You just made very clear that prevention is better than trying to cure it, and you can prevent it by keeping lower organics. But if you do find yourself in that situation, is there a recommended treatment for let's just say external? Because I know internal's a mess.
Well, internal, external, it's going to be the same.
Okay.
It's going to be different for pouch emphysema. For internal and external, the very first step is to move them to a clean new salt water in a hospital tank.
Mm-hmm.
And sometimes that by itself, if left there, is enough for the situation to resolve itself. Um, there is a product out there that is a prescription product called Diamox that can be used for reducing the gas bubbles if depending upon where they are. One of the internal gas bubble disease can sometimes be mistaken for a bad uh, air bladder, and if it's an air bladder issue, the Diamox is not going to do any good. But Diamox will actually help reduce the gas bubbles. The important thing to remember there is that the Diamox is treating the symptom, not the cause.
Right.
So you can reduce the gas bubbles with Diamox, but if you don't handle it's almost like taking cold medicine. Cold medicine doesn't cure the cold; it just helps you with the symptoms, and that's what Diamox does. So if you don't get to the underlying cause, the gas bubble issue is going to come back again. And in some cases, most people will treat with antibiotics. What I found over the years is that when I dealt with this, I didn't have to use antibiotics. Just putting them in good, clean water for a period of time, the issue resolved itself. Um, Pouch emphysema is a little bit different. In pouch emphysema, we suspect there could be there's some type of I don't know what's the right word I'm looking for, organics or dirtiness inside the pouch that's causing the gas.
Mm-hmm.
And in a single case, all we have to do is what's called a pouch evacuation and release the air. And the key to that is opening up the pouch and manipulating the pouch so the air comes out. What you don't want to do is squeeze the pouch and try to force the air out.
Right.
That can cause internal tissue damage inside the pouch, and it can cause the gas to go within the tissues instead of being just open in the pouch. We have what we call reoccurring pouch emphysema, where you release the air and air comes right back. In those cases, usually if you move them to a clean watered hospital tank, that'll usually resolve itself. But you can also do pouch flushes with clean salt water. And I find that's just as effective as what some people recommend in trying to do a solution of Diamox and antibiotics. Some people will treat with antibiotics. I'm not convinced that antibiotics is the answer.
Well, I've personally had a seahorse that had the bubbles on the tail that I just put in clean salt water and it got better. So, bravo for the answer. You're right, in my opinion. Okay, final one, guys, and then I'll start asking your questions and let anybody join who wants to. I'll do a quick reminder of how to join. But final question is weak snick. We mentioned earlier, that a seahorse stops eating. Weak snick is where they're kind of trying to eat, but not getting it down, or well, I'll let you explain, Dan, but what is the typical causes and how do you diagnose weak snick?
Well, weak snick can be first. What is it? Weak snick
Yes,
is
sorry.
when the seahorse is trying to eat. They create a suction and what we call the snick, where a whole bunch of different muscles come together. There's actually articles written on all the mechanics of what happens, but
Yeah.
it's actually a very elaborate process that happens in a fraction of a second, and it creates a very quick acting slurp, if you will, of food into the oral cavity. It gets macerated and then it goes into the gut. When something affects any part of those groups of muscles, tendons, or what have you, the slightest thing can throw the whole thing off. So they lose their strength or their coordination in doing so, and they have a difficult time getting the food in. And it can range from a very mild issue where they can get food in okay, but it's just not as good as normal, to where they can't get anything in. And in the hobby itself, I find that the most common cause of it is a buildup of parasites in the oral cavity. Usually, I think it's most commonly commensal ciliates that are in the tank that just accumulate and start creating a little bit of inflammation, and it just progresses from there. It can also be caused from a mechanical injury or trauma from snicking up something that they didn't mean to snick up. And then you also have the possibility of a bacterial infection being the cause or a secondary issue coming into play. It's interesting that when I talk to, or it used to be on Tammy's website, Fuse Jaw, she had an article on weak snick that was put up there by a veterinarian that works with public aquaria. And they found, their belief was in the majority of the cases, it was from poor nutrition.
Okay.
But it's a lot different in the public aquarium environment than it is in the hobby. And what I find in the hobby is that well over 90% of the time, I can easily identify it as being a parasitic issue. And the way that I identify it is I have them do a freshwater dip. And in most cases with a parasitic issue, when you do the freshwater dip, the seahorse is going to react very strongly, sometimes violently, to the freshwater dip, which is an indication of the parasites trying to burrow deeper within the flesh and making a seahorse uncomfortable. So that helps me diagnose it, and then from there we go on with treatment.
Okay, and really quickly, I want to say anyone who has to go through a freshwater dip, he says that they react violently. I was a mess the first time I had to do a freshwater dip. I was literally calling him Dan back and saying, it's so upset. But that, it really is a great way to determine if it's parasites, because if they do freak out, that means that it's parasites, and then you can treat effectively. So thank you for pointing that out. And then I think the final question I had, and I'm going to put up the link, guys, so you can join and then ask your questions. But what's the typical treatment for 4-week snake? Or if it's parasites and you've determined that.
The first treatment, of course, is the freshwater dip.
Yes.
And after the freshwater dip, I like to do a round of formalin long-term immersion where we do 1 ml of 37% formalin in 10 gallons of water. And we do that every other day for 3 treatments. Then we reevaluate. And if weak snake is caught early, sometimes just the freshwater dip itself can take care of it. But in more advanced cases, you have to do a round of formalin. If after the first round of formalin we're still having issues, then I usually recommend a formalin bath with a higher concentration of formalin, and then follow that again with a long-term immersion bath, and essentially repeat the process until we get them cleaned up.
Gotcha. Okay, guys. Well, that was it for my basic questions, because I just wanted to go through the common things. But now it's your turn. So I have put the link up on YouTube. I'm actually going to go ahead and try to put the link up on Facebook too. See if that will work. I don't know that it will, but I'm going to try. And in the meantime, I will ask Dan some of the questions that you have already asked, and then I'll be playing on the computer trying to get a link on Facebook too. Oh, before I do that, I wanted to mention that Dan mentioned to me that I needed to do a little tutorial for anyone who wants to join the stream. Let me tell you the difference really quickly. You can always watch the stream on Facebook or on YouTube or on Twitter, frankly, and comment your questions, and they will show up on my screen, and I'll get, ask Dan or ask whoever the guest is and ask those questions. We can answer them. However, if you want to actually join the stream, which means you would actually come into the stream and you could show us, a problem you're having, show off your great seahorses, whatever you want to do, show us your new coral, whatever it is. If you want to come into the stream, then you have to use Google Chrome, and you have to have Google Hangouts downloaded. Once you have those things, it's very easy to join the stream. I put a link up, or I can email the link to you. And just like Dan is in here right now, I actually emailed him the link as soon as I went live, and he was able to jump in. A lot of people messaged me right before the stream and asked where the link was. I don't have the link until I'm live because it changes every time. I'm looking for a better way, but right now that is the way. So on YouTube, if you go to Seahorse Whisperer on YouTube, there's now a link in the description or in the chat, and if you click on it, then it should take you to a place that says you're going live, and that's only if you have Hangouts already downloaded. And it'll say you're going to be in a live stream. You hit OK, and you join the stream, and then you're in here with us. So that's how you do it. Please feel free to try. It's no big deal if you mess it up. We mess up all the time. All good. But we'd love to hear hear you talk, and come on in and talk to us and show us your tanks and all that good jive. Okay, so I will say very quickly, Dan, the first question we had from the audience was, first of all, they all said you're supposed to be drinking wine. Naughty, naughty. And
Well, I would, but I can't until I get a couple things fixed. And with the vertigo issue, I can't drink.
I know, and that I'm kidding, but take care of you first, always, for sure. And then actually a Facebook.
And it won't be wine; it'll be Irish whiskey, by the way.
Right, Irish whiskey. Don't forget. Okay, so we'll go with Ray's question first. I see Joanne. I see yours too. But Ray's question on YouTube was, how do you advise someone who wants to know how they can determine just what husbandry water change protocol is necessary for their setup? So what do you say if somebody just wants to know? I guess that's the question. What do you...
Yeah, there's so many variables there that you can't really answer the question. Say it's going to be X amount of water or X percentage amount of time, or it's going to be a little bit of trial and error. It depends upon how good your filtration is, what kind of stocking density you have. Um, and then there's a difference in philosophy of whether you do more frequent, smaller partial water changes or do less frequent, larger changes. I'm in the school of doing less frequent, larger changes. So I don't think there is a set formula you can use. If you look around within the hobby, a lot of people recommend, 10 or 20% per week. Some will do 20% per month. And then, of course, there's some people that don't do very many water changes.
Gotcha. And I think this also goes back to even the question about you diagnosing and recommending treatment. It's really a case where, based on the individual circumstances, if they call you, it's that simple, or ask you in Messenger on your groups or whatever, then you can help them specifically with their specific situation. So, Ray, I'm actually trying as we speak to send you a link in email in case you wanted to join. So there, that's done in case you want to join. Anybody else wants an email linked? You somehow have to get me the email is the deal. But Ray, I sent you one, so if you check your email, you'd be in this call if you want to join. Well, it says sending. Hang on. It's very slow while I'm streaming. Okay, you should have it now. Let me know if you don't. All right, if anybody else needs one, let me know. And there's a link in the YouTube. Again, go to YouTube if you want to join. All right, so then, also
Is
on
that the white
Facebook.
box on the screen?
I'm sorry?
Is
Yes, I'm
that the white
sorry.
text?
Ray asked about the cursor too. Anytime I go to do anything on the computer, it kind of goes over Dan's face, unfortunately. Sorry. But yes, the
Okay,
white
no
box was
worries.
me inviting Ray. And
Gotcha.
um, we're still a work in progress, folks. Still, it's great. This is your chance to come in here and ask a professional expert breeder any questions you want. For instance, Joanne Farrar, excuse me if I mispronounced, apologies, asked, her tank is getting dirty and Aptasia is growing. She would like to strip the tank of the live rock. Can she take out the seahorses and do 100% change of tank and sump? Or what else do you recommend?
Well, you can do that. If you take them out and put them in a temporary quarantine or hospital tank, if it's not cycled, you'll have to do water changes to keep up with the ammonia. And if you remove everything out of the tank, the problem that you're going to have, unless you have some type of established biomedia, is that the tank is going to have to cycle. You can speed that along by buying live bacteria and adding that to the tank. Um, if you want to go after the aptasia, there's different products on the market that are designed to go after it. Everybody's got a different opinion, and some people have more success than others. But if you're trying to get rid of the aptasia, if you don't kill them, you may have to scrub the tank out and just completely start over. Um, it's just aptasia is a pain in the butt.
Okay. Sorry, I was reading another question, and I was trying to listen and read and do too many things at once. Apologies. But yeah, I did hear what you say, and there are some other options when dealing with aptasia. I think that Samantha answered your question in the chat. Thanks, Samantha. But if you have any troubles, message me on the side because I had to deal with it and it was awful. But I did get through it, and my tank survived and my seahorses. So also, Hunter, no worries. If people have to work and can't stay the whole time, that's okay. You come back when you have a question or, when you want to join, and we're right here waiting on you. So, very good. And guys, the more questions we get, the more often I can talk Dan into coming back. So, start asking those questions or join the stream, darn it. I wish Edwin was here. He could show us some things. All right. So Living Garbage asked a very odd question. He said, "Have you ever kept a seahorse frozen for any reason, such as an autopsy?"
Yes. In the early days, on seahorse.org, we had a lab technician, Dr. Martin Belli, who used to do necropsies for us. And the ideal thing is not to freeze them, but to keep them refrigerated. And then we would overnight the seahorses to him and he would try to come up with what he thought was wrong and what caused the demise of the seahorse. Um, the the best way to do a necropsy on a seahorse, unfortunately, is to do it immediately. In commercial aquaculture, if we're having an issue and we want to send them off for a lab for analysis, they'll request that we send a few live specimens at random from the group to sample to see what's going on. It's kind of hard to do when it's the seahorses, you got a couple of seahorses and they're a pet. Um, Marty, when he would do his necropsies, he would write up a report, he would post pictures of his findings, and he would give what he suspected was the most probable cause. And he did a lot of sampling with bacterias, and we were getting a lot of information as to some of the common bacterial issues that were developing within the seahorses.
Wow. And I've seen a lot of research since then too, by the scientists working on the different things. What do you have any idea what the big threat? Is there any particular bacterial thing that people most often hear of or most often have problems with?
Well, most commonly, what you'll see with seahorses, what appears to be the most common is one form or another of Vibrio.
Right.
A lot of people, Vibrio is actually, there's different species of Vibrio, um, many different species, but those are very common in seahorses. And then we also saw quite a few with acid fast bacteria, such as mycobacteria, and that usually is not treatable in, or is considered untreatable in fish. In humans that contract mycobacteria typically spend months on antibiotics.
Geez. And that's another point I wanted to make too. One of the things on your medication or your medic I can't even talk medicine cabinet is gloves and things like that. What were the other few things like you have the particulars for each parasite bacteria, blah blah blah, and then there was gloves and a syringe for any pouch evacuations or feed tube feeding. What else was on the list? Do you remember? I know I'm throwing that at you.
Um, I had clove oil on there.
Okay.
Um, Clove oil is used as an anesthetic, and it's also used if you're going to want to humanely put down the seahorse. Um, I had the hospital tank, and ideally, you want to cover at least one, ideally three sides of the hospital tank to make the seahorse feel more comfortable. I had the gloves. Um, I had an antibiotic. I had a antiparasitic,
Mm-hmm.
and I think that's most of it. There
I
may be a
think,
couple of other
yeah, no,
small items.
I think so too, and that's one of the things, like I said, that I think is really great is that your list is so small because as you've told me in the past, it's just the emergency things that you need to have, like something to start off, like save the seahorse if it's a predicament such as that, and then further things you've got time to work on or work with. All right, that I don't think that one was working. Let me try this other link real quick. I was trying to see if I could make a link on Facebook work. I'm not sure I'll be able to, guys, because it is a YouTube link, but feel free to try it. If not, if you want to join, you have to come on over to YouTube and you have to have Hangouts. Otherwise, all right, so I'm just trying to see. All right, Joey Hawkins said he recently lost a seahorse due to snout rot. How rare is that? Is it contagious, and how do you treat it?
Um, it, Today, it's relatively rare. We used
Okay.
to see it a lot more. Snout rot is typically from a bacterial infection that is right there at the snout's edge. And once it progresses to a point and eats away the tissue, that doesn't come back. So it's a pretty serious thing. If it's caught early and treated with antibiotics, it's usually, um, if you get it before everything starts deteriorating badly, the horse can recover. But again, if it does a lot of damage there, then the best thing to do is to put the seahorse down, unfortunately. As far as contagious, all bacterial issues are contagious. And anytime you have a seahorse that you think may be sick or is sick, it should immediately be separated from the herd. And the reason for that is for protection of the rest of the animals.
Sure. And is there, okay, because we've already discussed, it's hard to diagnose these things. And so, my answer is to just call you constantly. And of course, I try to help people here, and you try to help people in all of these different areas on the groups and such. But is there anything in particular that can alert you to this you should hurry up and quarantine, or are you saying they should just, if you see a problem, you should quarantine? And I'm saying quarantine, but
If
I
you
mean
see,
separate and quarantine.
yep, well, if you see a problem or suspect a problem, you should do it. And the reason that you want to do that is protection of the other animals, but it also, in most cases, gives you a better chance to observe the animal. Every setup is different. Some people's setups, it's not a big deal, but I've seen many setups where unless they move them to a hospital tank, it's hard for them to observe because they can hide in so many places.
Hmm. Okay, and right, that was a good point. When you quarantine, you can actually see them. Morgan, thank you for coming, and thank you for all the new people coming tonight. Really, please ask any questions you have, because I can't keep them very long if I don't have questions. And I know that this was the first time. Once I do the tutorial to show you guys how to very easily join the link. And join the stream. I think this will get better. We have some examples in some previous episodes of like people jumping in and showing us their tank. Salty's done it numerous times. And if it's bad timing, I get it, but definitely when you have a problem, or even if you just want to show us something, please feel free to join. This is very laid back and casual. If something goes wrong, we certainly don't get mad. We walk Ray through muting the YouTube every week. I love you, Ray. But anyways, thank you for coming, and yeah, please come back or ask any questions you have. I'm trying to see. Hunter said he's going to keep watching and do a 60-gallon only seahorse tank. Oh, guys, also, I'm very curious to any suggestions you have, what you would want to hear Dan talk about more, if I can convince him to come back. I want to make my part shorter so that you guys can actually ask him questions more once everybody gets a little more comfortable with this. But if you have suggestions for topics that you would like to hear more about, please let me know. If not today, on the page. Okay, so I'm just trying to think, is there anything other typical advice questions that you get a lot, Dan? I should have had your question of the week up, but I don't. So what other questions do you get a lot of?
I don't know. It varies a lot. I mean, it's, a lot of people will ask about the setups, um, the size of the tank and things like that. But usually, if somebody's ordering seahorses, I'll ask them what type of a setup they have and then make recommendations of what they should change.
Mm-hmm.
Sometimes immediate, sometimes, they've got time to do it. For example, if they don't have a protein skimmer, I'm not going to not sell them the seahorse, but I'm going to tell them they need to get one very soon. If the system is inappropriate, for example, if they're trying to buy, 4 seahorses to put in a 12-gallon nano cube, I'll let them know right up front that the seahorses just aren't going to last. I'll try to talk them out of the sale in that case.
See, guys, I told you he was different. Who tries to talk somebody out of a sale? He cares. Go on, sorry.
Well, in most cases, if they're serious about wanting to keep seahorses, they'll get a correct setup. Mm-hmm. So basically, I postpone the sale instead. I'll get a lot of questions about how critical it is about the temperature. Questions like that. A lot of the times, the questions I get are to confirm what they've read online somewhere, mm-hmm. or to, argue against what they read online somewhere.
Sure. Well, if you don't mind, go ahead and answer that for us, because I think you have a different opinion than I personally do. So, what is your opinion?
What do you mean?
How important? Answer the question. How important is temperature? I do know. I see that a lot often too, because people want to attach their reef tank to, even they're putting the seahorses in a separate tank, but they want to attach it, through piping to the main reef tank, and then the big thread is the temperature. So how important is the temperature in a seahorse tank?
Well, the important thing to realize is what happens with temperature. By going with the lower temperature that we normally recommend with seahorses, ideally somewhere in the 72 to 74 range, low to mid 70s,
Hmm.
it slows down the growth of bacteria and protozoans. And the higher temperatures, the closer you get to 80 degrees, the faster these things will grow. There was an article a few years ago that it was actually on corals, but it was a certain species of Vibrio. And what they found was that at temperatures below 75 degrees, it was non-pathogenic.
Hmm.
And at 75 and above, it became pathogenic, and it became exponentially more with each degree of increase.
Wow.
So, if you look, some of the public aquariums, for example, in England, they used to treat bacterial infections with seahorses by lowering the temperature to 64 degrees because the species of Vibrio they were dealing with there, the Vibrio would stop growing go dormant at that temperature.
Wow.
So it would stop the infection without having to use antibiotics.
That's so cool. So temperature is important, apparently. Okay, and then Salty Reef actually asked a question. He's all he said was his fry tank setup, but I'm guessing that he just wanted like an overview of your recommendation for a fry tank, I guess. And guys, that's kind of a really hard question because as a commercial breeder, his setup's going to be really different than anything we would, a hobbyist would do. It's just, but I answer how you want, Dan. His
I
question was
will.
fry tank setup.
Salty, the best thing to do is to go to my website and look under articles, and there's a section within the articles on raising fry. And within that section is a couple of videos that I've done on that topic, which actually goes through and shows my setups and how I do them. There's also a couple of other articles up there from other people, and it shows some smaller scale systems and how some other people are doing them. Um, Raising seahorse fry is a lot different than other fish because they're very slow swimmers and they're very susceptible to being sucked up into the filtration schemes. So you have to account for that. You can't have high flow, or it's difficult to have high flow. They're also on Artemia for long periods of time, and where most fish go through metamorphosis and then move on for um, other foods, seahorses stay on the Artemia. So there's a lot of different considerations, and I've given whole talks on that. So I really recommend taking a look at those two videos of me doing it at the MBI in 2012 and 2018.
And I actually have the links ready, so I absolutely will. Sorry, my daughter's setting up a phone, and my phone just said, "Do you want to share the Wi-Fi?" Sorry, guys. Okay, so I will provide the links to get to his site. Not that you can't do it on your own, but I will put the links in the description for anyone watching later. Also, okay, Joanne had another question. Thank you very much, Joanne, for all your questions. Anybody else watching, come on with the questions. All right. So Joanne wanted to know. She said, "I've only had seahorses since January. The male had babies right away. She got 10 to 12 She got the babies to 10 to 12 weeks old, and then they passed away. When she looked at other fry on the group, people putting pictures of fry, theirs were much more developed and bigger with color. Her Joanne's fry did not grow. Oh, I'm sorry, did grow. Wait, okay, mine did grow, then seemed to stop, and were all black, even though male and female were yellow. Any thoughts? Maybe I wasn't feeding enough. I started on BBS and then went to mashed frozen mysis." So the question was thoughts. Why the
Yeah.
fry died?
Well, the reason for the fry die and the most two common causes of losing fry is bacterial gastroenteritis, which usually a lot of that has to do with the live feeds that we're feeding, or the conditions within the tank, or parasitic issues because of high organic loading. As far as the growth rate, seahorses' growth rates are going to be directly dependent on food. It's a food conversion ratio. And um, typically, it depends on the species of seahorses, but typically we expect to start getting them to larger foods by the 6th week, whether it be adult brine shrimp or some form of mysis or other food that's chopped up and starting to increase that. If you don't get them transitioned to frozen at around 6 weeks or to a larger food, a lot of times they will continue on with the artemia. Their growth rate will slow down, and then sometimes they will actually become stunted. And I generally expect to see the way that we feed the seahorses and rear them. We generally expect about an inch a month in growth up till about 4 inches.
And I just want to add, obviously, Joanne, thank you again for the question. And this is one of those cases where actually, it's totally cool. Thank you for the questions again. But if you had actually come in, we could have asked you a few more questions, or Dan could have, sorry. But I'm not positive based on what you said, but if this was a new male who just you got him and he literally had babies, it depending on how big that seahorse was, it may have been his first batch. Everything in my personal experience has been that new or like I've raised seahorses, completed the life cycle to where they're having their own babies, and the first batches are always smaller. The fry just tend to be weaker. It's like almost like the seahorses have to get used to it and learn how to pair up well and make good eggs and whatever. But anyways, I never have had luck with the first batches. And when you mentioned that they all turned black, I just wonder how you were doing your fry setup, because that makes me just automatically think possibly like ammonia. Um, Not saying it was, but I've made so many mistakes it's not funny, and the only way we learn is by talking and correcting. So, just I'm curious to hear more about how you set it up, and I'm sure we'll talk more in the group. But yeah, ammonia it would be a big thing in a fry tank unless it was really well set up. So okay, and let's see. I'm trying to see if there's any. Oh, and she did not. Oh, she did mention she did not get the erectus fry to frozen until they were 8 weeks old. So maybe that very well could have been part of it. Who knows? But anyhow, all right. So can you think of any other? Okay, wait. I'm sorry. I'm sorry, Joey. I do see your questions. Okay. Joey said, "How long can a seahorse go without food? He feeds twice a day, but if, oh, I'm sorry, sorry. Okay, it says, I feed twice a day, but if she doesn't feel like eating one morning, is this okay? Because I stress out and think that she might be sick. So if the seahorse doesn't eat, what is that?"
Um, well, how long can a seahorse go without eating food
Yes.
is a great question. And I'm going to separate that from the rest of it.
Okay.
We don't know how long they can go. We do know that once they start excreting a long, slimy stuff, that they're on the verge of their intestines shutting down. They used to think that somewhere around 3 or 4 days was the maximum they could go without food, but I've seen seahorses go 12 days and come back.
Mm-hmm.
As far as the seahorse not eating one morning, that can be normal. It could be something going on that for whatever reason they just decided they don't want to eat that morning. I would pay close attention and watch what happens after that. And if she resumes eating, then I wouldn't get too concerned. If, on the other hand, that she continues not eating, then it needs to be addressed. And the sooner you address it, usually the better the outcome.
Yeah, honestly, that surprises me. And I heard your answer, and I agree. You're the Godfather. I'm listening to you. But my seahorses are always crazy. I'm curious what species you have, Joey, because I keep mainly erectus. I do have some other species, but the erectus are my bread, my main ones, and they never don't eat. They would eat. They try to eat stuff that's not food. So I'm just curious about that. Um,
Well, Erectus will yank a peanut butter and jelly sandwich out of your hands.
exactly. So I'm
But
curious.
some of the CUDA, some of the combs, and some of those are not as aggressive in feeding. The Barbary are one that they just daintily sit there and watch the food drop, and yeah, maybe I'll get over there, maybe I won't. Um,
Princesses.
there are some seahorses that have different. It's interesting if you sit and watch a tank. You'll see, if you've got a bunch of them in there, you'll see a mix of different seahorses do different things when it comes time to feeding.
Mm.
You've got ones that attack the food at the surface. You got ones that wait for it to come to them, and you got the ones that wait for till everybody else is done and then go around and pick up the scraps.
Gotcha. Right. Well, so again, I was just curious because I'm sure it is fine, as you pointed out. Ray did ask, though, that he's curious about your feelings on how often to feed adults, how much, and Ray has decided for himself that the seahorses seem to be healthier with more frequent feedings, slightly less per feeding, but more frequent feedings. And there's no right or wrong here. We're just talking about, what Dan thinks is best.
Ray, I would agree with the more frequent, less amount more frequently. That will mimic more of how they eat in the wild. Um, when it comes to keeping seahorses for the average Joe, though, the average Joe has to work for a living. They've got other things going on. So we try to work around that. And my recommendation to most customers is a minimum of twice a day. And then, if possible, ideally 3 times a day. For some people, that means morning before they go to work, when they get home from work, and then a little later on in the evening. And as far as how much, it's however much the seahorse will take. I don't believe you can overfeed a seahorse, but you can overfeed a tank.
And that's one of my favorite lines of yours. That you can't overfeed a seahorse, but you can overfeed a tank. Heck yeah. Ding. Okay. And Joey said thank you very much for the answers. And he does have CUDA. So that, I don't know what that tells you as far as feeding, but he has CUDA. Go ahead.
I'm looking at Joey's answer,
Yes?
um, where he's got, okay, thanks, I have CUDA. She also, do seahorses get emotionally attached to their tank mates
Yes.
as she looks sad and moving less now that her tank buddy has died? And the correct answer here is it's entirely possible. Quite often, you'll see seahorses go through a period of what appears to be depression when they lose their tank mate. Um, it I hate for you to turn around and just buy another seahorse and put in there with her immediately, because usually after somebody's lost a seahorse, I like for them to wait a few weeks before they add another one in case whatever was in the tank continues onward. Sometimes infections will show up later on, not immediately. What you can do that is sometimes helpful is to take a small mirror and tape it or fasten it in some fashion to the tank where she sees the reflection. And sometimes it'll fool them into thinking they have a mate in the tank with them. And when it works, it's hilarious to watch. Doesn't always work, but I've seen it work in many cases.
So there
That's
you go.
about the only thing you can do except for waiting it out. If she continues not to eat, then um, you can try enticing her with live food. You can add a drop of garlic to the frozen food, let it sit for a moment or two, and add that to the tank. Garlic will act as a food attractant. And then lastly, there's the old vitamin B12 trick where you add vitamin B12 to the tank, and that too is an appetite stimulant.
I actually want you to say that if you don't mind. But really quickly, I didn't want us to miss this because I realized I'm jumping you through multiple questions, so it's probably my fault. But Joey is actually the person who lost the seahorse to snout rot. So my question
Yep.
is, if this seahorse now is not wanting to eat sometimes, is that a sign of anything? And
No, not necessarily,
okay,
because as he pointed out, losing their mate will often
right,
put a seahorse in a depressed, just like with humans, when you lose a mate, you go through a period of depression. You see it with dogs. It's it can really it mimics depression, and it takes some time sometimes to come back to it. Now, there are instances where they just seem to just shrivel up and go away, but in most cases, what will happen is they will take a little bit of time and slowly come back, and especially once you can add another seahorse back to them.
sure. Now, in this particular case, last question about it, but in this particular case, what causes snout rot again? Is there, do you know off the top, or is there multiple things?
It's bacterial infection.
Okay, so bacterial infection, and you said he should wait how long before adding another seahorse just to make sure that the final seahorse does not have anything?
Um, nobody has a set thing and carved in stone on this. I recommend a minimum of 2 weeks, ideally 6 weeks.
Okay, and just keep an eye out and be ready. Have your medicine cabinet with at least one, like Furon 2 or something in case, just in case. But and
Yep.
we're very sorry for your loss, by the way. I should have said that earlier. Sorry for that, and we're glad that you're here. Thank you, and we hope your final CUDA does really well. Please let us know and keep us updated. Um, Oh gosh, what else was I gonna ask? Oh, can you go ahead, because I did email Edwin with the B12 information and recommendation. Can you tell me that really quickly, and then we'll check for any more. Hi, Briley. We'll check for any more questions, and then I'll let you loose. I know I've kept you a while, but can you explain B12?
B12 is a vitamin, and B12 is known to be an appetite stimulant. And I first learned this from Kelly Jalecki, who was known as the puffer queen on the board. She had a shark that she was having to hand feed, and it wouldn't eat on its own, so she was having to stuff meat down its throat every time. So one day she took a whole wad of B12, stuck it in the meat, stuffed it in the shark, and after that the shark started eating. And her recommendation back then was to take 5,000 micrograms and put that in 10 gallons of water once a day. And that would often take a finicky eater and boost their appetite up to where they would eat better. Um, B12 is non-harmful to the tank. It can be done in a regular tank, though I prefer, as with most medications, to be using a hospital or a quarantine tank while doing that. It can also be done in conjunction with other medications.
And you did say, but it doesn't affect the biological bacteria, right? Or
No,
the beneficial.
won't harm the
Okay.
biological. No.
Okay.
Now Joey's come back with a question.
Yes.
Joey, my question is, with the antibiotics, are you treating the display tank with the antibiotics?
This is why it's cool when you join, because you guys can actually talk back and forth. I'm just putting the pressure on. But yeah, Joey, the question for anybody who can't see it was, he said his tank is currently being treated with antibiotics, currently 6 out of 10 day cycle. So good question, Dan. Whether or not and can you explain why you're asking that, since we have to wait on a response?
Yeah, the reason I ask that is because if you're doing the correct amount of antibiotics and the antibiotics are working correctly, they should affect your biological filter and can destroy your biological filter. You also, by using antibiotics in a typical display tank, um, you have many other things in the tank, organics in the water. You have, sand and rock and all the other different things. You have the antibiotic sometimes isn't as useful as it is in a sterile bare bottom hospital tank with clean new water. So I find that it's better to treat that way. The only time that I would ever recommend using antibiotics in the display tank is if you're gut loading Artemia and feeding the Artemia to the seahorses, thus giving it to them orally. You're not going to have the same impact.
And well, Dan, just since he's already on day 6 of 10, should he just complete it at this point, though? I understood your point that it's better to be done in a hospital tank so you don't risk your beneficial bacteria. So, Joey, please watch out for ammonia and nitrites if there is.
Yeah,
Yeah. Go
keep a
ahead.
real close watch on your parameters, and I would consider adding bacteria, nitrifying bacteria to the tank immediately afterwards.
Yeah.
And I would also consider maybe adding probiotics to the setup as well.
Very good. So, in case that, yeah, so he's already covered it. Add bacteria afterwards. Watch your parameters for sure to make sure you don't have any ammonia or whatnot. Add probiotics possibly afterwards to help the seahorses through. And then also, I was just thinking, when you treat a display tank, often there's like carbon or other things along those lines, and many of the medications won't work if you've got carbon in your filter or any of the removers in your sump or anything like that. So, next time, no big, everything. Thank you for coming, and no big deal. If it's working for you, it's working. Bottom line, definitely finish it out. It would be my advice. But anyways, okay, all right. And anybody else? This is last call. I've kept him for an hour and a half. Thank you, Dan. And is there anything else you can think of that you would want to get? Oh, I do have one more thing that people still come, and it's not related to diseases, but can you just tell me very quickly for people that come and watch later, because people still can't seem to understand the flow situation. So can you tell me what flow rates and how you recommend flow for a seahorse tank in general?
You mean how much?
How much, or do they need low, or that kind of thing?
Low flow is typically not good for almost any tank. Low flow does not keep the waste matter suspended in the water column to where the filtration can take it out. Higher flow, you have more passes through the filter, which in turn removes more stuff. With the seahorses, my recommendation on flow is as much as they will tolerate. Every tank is going to be different, so I can't sit here and say it's going to be X amount. Generally speaking, I'm looking for 10 times turnover of the tank per hour or more. And I've seen it go up as high as 40 turns an hour if it's broken up well enough. When you There's too much flow when the seahorses are doing somersaults across the aquarium. They should be able to move around, but if they can move around easily and things aren't staying suspended, you probably need to increase the flow. The seahorses will strengthen up and become stronger swimmers as the flow increases. Um, so I like to have as much flow as I can possibly have in the tank.
Agreed. I just wanted to get it out there because that's a question everybody asks. And one final question for you, unless I see another question by the time he answers this, then we'll call it quits. But we talk a lot about things like organics and husbandry and these words that I know when I first started, when you guys said these things, I got lost. I'm like, what's that? How do you know
Yep.
organics? So my question is, for someone new or whatever, we mentioned that you need good husbandry and you want to keep organics low. Is there any basic way that you can explain how to do that, or what you mean by that? Give someone brand new an idea of what you're talking about when you say that.
Well, or seahorses are different than most other fish because of many different reasons. But one of the key aspects that most people don't realize about seahorses is that number one, they eat a lot. Um, I've read different reports of percentage of body weight in terms of food, everything from 8 to 20% of their body weight they're capable of eating in a day. Um, that's a lot of food. And the mechanics of how they eat food, they snick it, they macerate it, and if you watch closely, it looks like smoke coming out of the back of their head where the food's macerated, and those are actually fine food particles being ejected back out into the tank. And according to one of the papers I read, about 8% of what goes in the snout comes out through the gills through the maceration
Oh wow.
process. So then it then goes to the gut. They don't have a true stomach. Instead, they have a little outpouching in their intestine, and their um, digestive system is very crude, but it works for them. But it has a very fast transit time, typically about 10 hours from when they eat something to when they, excrete it out the other end. Because of that fast transit time and their crude digestive system, about 23-24% of what they eat does not get digested.
Mm.
So when you look at what the seahorse has actually eaten, almost one third of it is going back into the tank as raw organics. And organic matter in a tank is what feeds the protozoans and what feeds the bacteria. When you have high organics, these types of organisms will proliferate, especially in a low flow environment. And unfortunately, there's no real test out there to test at the hobby level how much organic matter is in a tank. Your ammonia could be fine, your nitrates could be fine, your pH can be fine. You go check all these different parameters, but you can still have high organic loading. And the way that we prevent that is through having the proper stocking density. You don't want to overstock the tank. You don't want to have low flow. You want to increase the flow. You want to have good filtration, a good performing protein skimmer.
Hmm.
And on the mechanical filtration, when possible, I prefer tanks that have a sump where you can use something like a 100 micron filter sock and then have other, whether it's a sponge or whatever, more things for the water to pass through to collect the organic matter.
Gotcha. So, recap for anybody who's really, really new is they eat a lot, they poop a lot, and we've got to make sure that the flow and the filtration takes care of all that, or the excess food and organics will feed all the bad guys and cause problems. There's your summary. All right. Okay. Well, nobody else popped off. Oh, nope. Nobody else popped off with a question. So, I will be talking Dan into coming back. So, you guys make sure to have more questions ready next time. I'm just kidding, you guys. Thank you so much for coming. And, hopefully, as I do the tutorial and show people how easy it is to join, we'll get some more people in here, have an actual conversation. It'll be great. But thank you all for coming tonight. Thank you, Dan, for being my guest and sharing all of your wise wisdom with all of us. I appreciate it. And if you have nothing else, did you have anything else you needed to cover or say?
No, I guess I'll wish everybody a great night.
All right. Happy Wine Wednesday, everybody. Cheers. Okay.